Yeah, I think so.
Okay.
I think we'll go ahead and get started. I know we have some people that are attendees today that are watching as well. So I try to keep us on time. And I know today could go a little bit longer just because it's our first meeting with the different task kind of people coming forward. So to start us out, Mike, can you start the PowerPoint for us, please? So we've tried to put everything kind of on the slide so it's easier for people to follow along. And if they haven't, if they couldn't join us this morning and they want to follow up, go ahead, Mike. First of all, just the district task force is quite small. This is really the group of people that have to make decisions on, for instance, reopening decisions. Definitely, you know, from my perspective, I have to consult with Dr. Noble and Mary Keller, who helped me from the superintendent standpoint. Karen Hirsch is also our Board of Education representative, so she's got a huge job to keep her other 7 colleagues all well informed on what we're doing. And also members of the cabinet who lead on all of these different subgroups of activity that have to take place, and we have to think about going into the fall. Go ahead, Mike. So these are the different focus groups right now. We have the health advisement, which of course we'll get an update on kind of what's happening with COVID from Kati and Mary's perspective, also what's happening just at the state level right now. School scheduling complexities. This is probably the most complex piece of opening for the fall, has to do with scheduling. Transportation, food service, athletics return to play. And this also includes activities. District communications, how we're communicating, what are some of the extra steps we must take this summer, facilities, disinfecting and cleaning protocols, kind of where we are right now, our human resources staffing and all the health related challenges. There will be obviously curriculum instruction, which includes the distance learning, what we're doing there for the summer. We've already changed our approach to distance learning for summer school, how we are approaching teacher professional learning. And then also our special education, which we do have some related services that are face-to-face this summer. We're one of the few districts that are doing that. So that will be a huge learning opportunity for us, our EL students, and also just unique learners. And this kind of just gives you a graphic because I like pictures. It just helps people understand how it works. So the district task force is taking input from all of these focus groups that are on the outer edges. And the goal is really to make sure that if somebody's involved in facilities, they're really spending their time helping advise us on facilities and safety, because we don't want them necessarily sitting through a meeting where we're talking about, for instance, communications, and they're listening to an hour of a meeting that really has nothing to do with the work that they really need to be doing. So we're trying to be very focused and where our areas are. We are on overload, I would say right now, with all of these focus groups in the available information for us from all of our major organizations from across the country that have reopening plans. I have probably 10 different reopening plans sitting on my desk where we've been provided examples. We have lots of our regional organizations who are also doing webinars, hosting webinars. So we're all contributing and hopping onto those as well. Thanks, Mike. So really 4 overarching goals for us. The first one is really prioritizing our youngest learners. We've heard that loud and clear in those K-5, trying to get them physically present in the school building for instruction. We know that their parents can't go back to work if we don't have K-5. It really impacts those families specifically. High quality program for all ages, whether that's distance learning or hybrid. We do want to maintain safety and security, considering the guidance. And right now, the CDC guidance is still very, very stringent. The World Health Organization, our Connecticut State Department of Health, Greenwich Health Department, head of nursing, and our medical consultant, we take all of those. The main driving document is going to be the guidance document that actually comes from the state. We've been told we're getting some information tomorrow, and we may have more information coming early next week with the brand new document. We were hoping we'd have it in our hands tomorrow, although late yesterday they said it could be early next week, but that tends to change from day to day. That will be the main document because it's very difficult for any school district to go against, whether it's guidance or whether it's a requirement, from a liability standpoint, it'll be difficult to have the medical professionals advise us as a district and me that we need to be back in school like normal if the guidance from the Connecticut Health Department says it's dangerous to do so. So that it's going to be, it'll be interesting to see where the guidance comes out for us. Also, just the focus on social emotional health of staff and students. That's key for us in all of our planning work. We are preparing for the 3 options, and we've said this at several board meetings. Full return to school, which at least right now does not seem likely by everything that we are hearing, not only from our negotiating bargaining units and the work they're doing with the governor's task force, which is CEA and the National Federation of Teachers, and how comfortable teachers are. Right now, they believe that we should be meeting the CDC guidelines, which are still extremely stringent. So full return to school may be somewhat challenging, but again, this changes daily and it changes weekly. A hybrid approach, some days on campus, some days off, and full distance learning. So we're going to start. Mary Keller we're grateful for her. She served on the governor's task force on our behalf, and she's going to share a couple of slides. And Mary, I believe they're going to use the PDF, so Michael's going to bring that in for you. And then followed by that will be Dr. Noble, who's going to update us on what's happening with COVID from her perspective around the country and in Connecticut. So Mary Keller, I'll turn it over to you when you see your first slide.
The opportunity to represent Greenwich and have our voices heard. As it happened early in May, this committee was tasked with identifying obstacles that we faced and hopefully to propose solutions in light of the constraints prompted by this pandemic. As you will hear, the coronavirus was a new and previously unknown entity, and to this day, in many ways, it remains the same. If anything, we have to acknowledge that it is a to learn as you go type of thing. We have to be adaptable, creative, and always keep our eye on the goal, which is, to keep education at the top of our list. One of my favorite quotes states that there are many ways to scale a mountain, but the view from the top is essentially the same. So the members of the task force were selected to represent a cross-section of the stakeholders and experts with knowledge and experience to look at recommendations and concerns. The first review we looked at consisted of analyzing the feedback collected from constituents across Connecticut with the use of an online data collection tool called Thought Exchange. They collected over 34,000 responses, and the overwhelming concerns identified were, in order of importance, obviously the safe return of students and staff, followed by supporting physical and mental well-being, mitigation of disease, effect on operations and logistics, communication, teaching and learning, and the potential for a second wave in the fall. In addressing these themes, we identified areas that need to form the backdrop for our recommendations. Attention to the stages of recovery for students and staff should be addressed first and foremost. Coming back will likely be and feel differently for individuals who may have been ill, faced with financial hardship, or have actually lost a close family member. So in that vein, we need to be cognizant. We need to make assessments of the learning that has occurred and will going forward. Recognition that we should avoid simply replicating schools as they are now. Obviously, they will be different. We need to recognize the social emotional needs of students, teachers, and families. This should be a very high priority. We need specific details around health, contact tracing, monitoring, and triaging of worst case scenarios. We need to collaborate, sharing of ideas, and document across the districts because consistency is reassuring to everyone. And we need to understand, of course, the financial implications of the changes and operational shifts we need for the health and safety of everyone. What is logistically possible in some districts for plans and strategies may be impossible for other schools, especially at the secondary level, which I think we all understand too well. We must look at the impact of the potential loss of sports and the arts as motivators for kids to attend school. So as we currently stand, looking at student and staff well-being, I think, is there more to the slide? Yeah. We need to have health policies and procedures in development or in place. And as Tony mentioned, we've been expecting and hoping to have the governor's final recommendations this week or at the beginning of next week. So for now, PPE are recommended for various levels of risk, being different for nurses, obviously, custodians, paras, and teachers. And we do understand that our supplies will be available to us through a state consortium. I think we are in fairly good shape with PPEs. Facilities have received guidance on cleaning and disinfecting for routine and exceptional circumstances. Exceptional circumstances would be if someone came back and into the nurse's office and we felt that they were had positive symptoms. Staff training is highly recommended to include safe use of PPE, both in demonstration and for purposes. Hand hygiene training, disease symptoms, and spread should all be shared with the staff. Social distancing, which is a tough one, I understand. Further clarification is coming, I hope, is recommended when possible, but mask use, cohorting, and ventilation are used in adjunct with social distancing and we're not able to social distance. We need to understand illness surveillance either by or with temperature assessment and symptom and exposure history. We need to be able to isolate and contain potential illnesses that might appear during the school day. We need recommendations for return or stay at home. For now, it appears to be 7 to 10 days with a positive test and a healthcare provider note to return. But I have to say, this could change. This goes anywhere from 2 to 14 days. Moving on to social emotional well-being, the task force recommended targeted interventions to support students and parents at home if and when needed, provide guidance for safe and effective practices in school, open communication, special attention to medically and emotionally fragile children, and partnerships, maintain partnerships with community resources. Mitigation as it currently stands. So social distancing still stands at 6 feet or more. Masks are still recommended for all that can. No visitors in the school. Cleaning and disinfecting should be done when surfaces are potentially contaminated. And anyone with the signs or symptoms of illness should either not come or leave quickly. Under operations and logistics, budget considerations, we identified strongly the need for state solutions and assistance. For state regulatory changes, we suggested optional calendars, immunization and physical requirement waivers, and attendance policies be revisited. Transportation considerations, especially with regard to social constraints, we might have to have regulatory changes to achieve this. Communication, clear, consistent, culturally sensitive, and timely. Teaching and learning, we recommended concern for equitable programs across all demographics, assessment of impact of distance learning, expectations for all models of return, improved distance learning resources if we should have a second wave, regional professional development, and a statewide curriculum development for distance learning. And my last slide is the recommendations from the CDC. It's that one. I think we are good with opening and monitoring. I think we have achieved all the recommendations here. The one that stopped most everyone was in the first column, the bottom one, are you able to screen students and employees upon arrival for symptoms and history of exposure? But I think that we've been making plans for temperature and symptom surveys or symptom questionnaires, and I think we're ready to go with that. And I think I'm done.
Thank you, Mary. Katie, if you want to go ahead and start.
Absolutely. Thank you very much for asking me to speak. So to start off, I am actually going to start with a brief story. On January 27th of this year, I took care of a 13-year-old boy in my office who had a fever. He tested positive for influenza B. I prescribed the appropriate medication, and as I turned to leave the room, the boy's mother asked me, "What do you think about this coronavirus infection in China?" I paused and I responded, "Well, while it may be a concern, I wouldn't lose sleep over it. I think you're more likely to be hit by a bus than to be infected with this virus." Looking back, I cringed because I could not have been more wrong. And then shortly after this, I accepted the role of medical advisor to the Greenwich Public School System. And I thought to myself, what a great opportunity, but what if there's a major health crisis? So next slide. Launch forward to today, June 25th. We have been coping with this massive COVID-19 pandemic since March, and we face unparalleled challenges. I take this new role as your medical advisor with great seriousness and a deep commitment to work with you as we face forward and climb this enormous mountain. I have a strong vested interest, not only in my pediatrician for many of your students, but I'm also the mother of 3, 2 of whom are in the Greenwich Public School System at Greenwich High School. So I approach this role with a spirit of honesty, transparency, and tenacity. And if I can't answer your questions, I will work diligently to help find your answers. Next slide. As a Harvard-trained pediatrician, I have been trained in the tradition of evidence-based medicine, which relies on data-driven decision-making. But in the era of COVID-19, the evidence is being built now for decisions that need to be made now. And arguably, some of you may be saying the decisions need to be made yesterday. And that's an extraordinarily difficult predicament to be in. I've actually participated in weekly pediatric community clinicians COVID-19 Q&A meetings with Yale, and specifically with an expert leading it by the name of Dr. Thomas Murray since March 18th. And I can tell you that information and recommendations continue to change extremely rapidly, just as Mary mentioned. I reached out to him in preparation for this meeting, hoping that with his expertise and background that he would be able to give me specific guidance for the meeting today, only to discover that he also sees reopening as a very complicated situation. Next slide. So now I'm going to share some information on what's happening today with COVID-19. And to start off with, many of you have probably heard this, that COVID-19 is actually on the rise in a number of states. Next slide. Certainly, Connecticut has been hard hit with over 45,000 cases since the beginning of this and over 4,000 deaths. Next slide. It's important to note here, you can see that Fairfield County has been a hotbed of COVID-19 infections since the beginning. And next slide. So you may be asking, well, have we flattened the curve? And next slide. The data would suggest absolutely yes. It seems as though the curve is flattening. And this is from Johns Hopkins University. And this is a graph showing daily confirmed new cases. And you can see that now we're in June, we're on a significant decline in new cases. Next slide. So the CDC's forecast is actually quite favorable for the state of Connecticut. And you can see in the chart off to the side, the curve is flattened and the projection for July looks favorable at the moment. Next slide. So what I'd like to do is shift gears for a moment and speak specifically on the topic of COVID-19 and children. Next slide. The data that we now have, as many of you know, suggests that COVID-19 is not so much a pediatric problem. The disease burden is lower in children and the clinical course is generally milder than what we see in adults. You can see here in the United States, 2% of the cases have been confirmed among children, among persons less than 18. Next slide. And this has been borne out in my office as well. Fortunately, none of my patients have suffered from severe COVID-19 disease or serious complications. So pediatric COVID-19 outcomes tend to be quite good. And I'm happy to report that we even had COVID-19 roar through my own family. I was actually very concerned. My husband had a number of risk factors, and I'm happy to say he survived it. And I'm happy to say my children did too. So The course and complication rate in children, again, tends to be very, very mild, and many, many children actually are completely asymptomatic. Next slide. And again, the outcomes tend to be quite good. There have been very, very few deaths associated with COVID-19 in children. Next slide. I was especially excited to read this Washington Post article in earlier this month on June 16th. They actually cited an article that was just published in Nature Medicine, which found that children and teenagers are only half as likely to become infected with COVID-19, and they usually don't even develop clinical symptoms. And the disease caused by the virus tends to be much, much milder. Next slide. So I'm going to highlight here a little bit of the data from the Connecticut Department of Public Health by age group. Next slide. So here's the case report data for Connecticut, according to the Department of Public Health. And you can see the burden of COVID-19 disease is much, much less in younger patients. So you can see the chart highlights that at the 50 to 59 age range, there are many more case reports than our pediatric patients. Next slide. And the death rate is significantly less as well. And you can see only one death in a 0 to 9-year-old, one death in a 10 to 19-year-old. And you can see on the far right, of course, patients 80 and older fare much more poorly. So this is obviously a challenge because I understand while my focus is generally on pediatric patients, I now am advising on not only pediatric patients, but also teachers, which represent a much more broad age range. And that obviously is of concern for all of us. Next slide. One of the biggest challenges that we face, next slide, is that COVID-19 in pediatric patients is sort of like, it's like the sheep, the wolf in sheep's clothing. And so children generally present, if at all, with fever, cough, congestion, runny nose, and sore throat, which is basically like the common cold. And this is the biggest challenge for all of us as we look to reopen schools. Next slide. So as we approach the uncertainties of fall 2020, it's important that we're thoughtful, that we're creative, and that we're prepared with multiple contingency plans. We need to be decisive and nimble, quick to adapt, and change as needed. I contacted one of my advisors from Boston Children's when I was preparing for today's talk. He's known as the Pediatrician, Dr. Michael Rich. He's actually an expert in media and child health, and he's an associate professor at Harvard Medical School and the Harvard School of Public Health. And I was really shocked by what he shared with me, which is that the Boston Public School truancy rate this past spring was 26%. And they, like the Greenwich Public Schools, offer distance learning, but without live interaction. And many more apparently dropped out as time went on. And he told me that distance learning without this live element left many children and students feeling very aimless. I had the opportunity this spring to observe firsthand the differences between live and pre-recorded distance education. My youngest child was taught through Zoom at GCDS, and my older two children at Greenwich High School were not. All three of my children had excellent teachers, but without live teaching, the struggle was much more significant and at times just downright disheartening for my older two. Next slide. So my view is let's get kids back to school, but in a methodical manner. Children and adults do better with some structure, limits, goals, and finish lines. And whether we are talking about education, athletics, or the arts, it's so important. Social interaction is a very, very key human need, as we all know. My patients and my children have missed this so much. And without a more structured return to school, we will see increased rates of depression, anxiety, suicide, media addiction, truancy, obesity, domestic violence, and other really serious problems. So let's take the opportunity this fall, when the rates of influenza and other viruses is generally so low, to get kids back into the classroom as much as possible, and then make adjustments as needed. So I look forward to taking on the challenges of back to school in August 2020 with you. And I leave you with this thought-provoking quote by Albert Einstein: "The measure of intelligence is the ability to change." Thank you very much.
Thanks, Katie. At this time, I just want to ask the panelists, do you have any questions that are health related that you would like to ask Katie or Mary, also about just the task force work? And I will say my phone is very busy this morning because Mr. O'Keefe is on the call with the commissioner, and we do expect to have more guidance this afternoon around 4 o'clock. So I think we will see changes even on the very day we're having this big conversation. But just, you can use the raise the hand feature if you would, if that makes it easier. If anybody has a health related question.
Oh,
No?
Mary Ford, did you have something I can't hear you.
Do we think that the changing demographic from the southern states, where they're seeing more younger people getting the virus, will have any impact on us in the fall?
I mean, that's a really good question. One of the challenges that I face as your advisor is that I'm a pediatrician and not an epidemiologist. And I would argue that even Dr. Fauci and Dr. Birx don't necessarily have answers to all the questions that are out there. What I see happening in the South seems to me to be just more of this initial wave that's just sort of going through. And I'm not aware myself that what's happening in the South is specifically attacking younger populations. It may be, and I don't have the numbers in front of me by any means, but it may be that down in the South in some of these communities, it may be that some of these kids have poor access to care. It may be that there are greater rates of obesity, which we know is a risk factor for doing poorly with COVID-19. They may have poorly controlled asthma and other conditions. So, and I hate to say this, but the press does no service to us when they highlight this just in, these children are dying, and it just, I think we have to just keep going back to the CDC website for the facts and take out the sensationalism.
Anybody else have questions? And I'm not used to controlling these meetings, by the way, so I'm trying to watch when you use the raise the hand feature. Okay, we'll go ahead and continue on. We have a lot of information today. So when we look at return to school planning, and I think you heard it loud and clear from the medical standpoint, we must be thoughtful of student needs, thoughtful of teacher needs, and sometimes those are competing interests. From a school district perspective, that will take a lot of work on our behalf to make sure everybody's in that comfort zone. Thoughtful of staff needs. We have staff who have, for instance, food service, who are still right now in the summer out delivering in what we consider on the front lines, with families and out in the community. So, and thoughtful of family needs. And I know at the state level, that's been part of the discussion, is especially for younger learners, where it's so difficult for parents to go back to work, depending on their schedules, which has impacts on not only the state economy, but local economy as well. It's taking all of these interests, and they're not always aligned. Let me put it that way. Mike, go ahead to the next slide. And I'm actually going to invite Ann Carabillo to talk about the curriculum and instruction slides.
Okay, so you see a variety of different types of supports that we are using to make sure that we are addressing all of the curriculum and instruction questions that we have and approaches that we have as we move forward with our planning for this summer and for next year. Next slide. So I wanted to share some of the professional learning that we have live this summer that teachers have advantages to go and learn about how to set up a Google Classroom and then Google Meets and Jamboard. We have a variety of teachers that have already done a lot of work, and I would like to read an excerpt from one of our first year teachers at the end of this past school year. He wrote to his colleagues and he said, I was lucky enough to interview 7 teachers about how they're spending their class time during distance learning. And I was blown away by the creativity, resilience, and passion of our department. It's fitting to be sharing these interviews during our Teacher Appreciation Week, as I feel extremely grateful to have learned so much from my colleagues sharing their resources with me when I began interning at Greenwich High School in 2009. In that spirit of collaboration, he's including a link to 7 interviews that he did with their resources of teachers that related to his interviews. Think of it as a professional development playlist that you can view whenever you have free time or would like to explore a new resource. I'm also including the interviews and the resources below. And thank you to all who participated. And if anyone else would like to be interviewed about a new resource, project, lesson, or idea, I'd love to talk to you and keep the list growing through the year. So we have a variety of teachers that we already know have become very expert, and we will be calling on them to help us with our focus groups and to help us with our planning as we move forward. Next slide. These are other asynchronous sessions that are available to our teachers over the summer, and there will be live questions and answers that will follow the training. So if teachers are watching this and they're doing it on their own time and they have questions, then they can come back when there are questions and work with the coordinators who are doing all of this fantastic work.
Thanks, Anne. And I might just add also that we are seriously looking at the calendar right now as we look at the workload on teachers, because, you know, I've had the question, what are you mandating in the summer? They're not on contract in the summer for teachers. So these are workshops that are available to them. We do have some curriculum work where teachers are actually paid and are brought in to do that work, and we're doing that as well. But we're looking at the calendar at the beginning of the year, and we may be asking the board, we don't know yet, to add 1 or 2 professional days at the beginning of the year to adjust the calendar. As we start looking at what are the building protocols going to look like, we have to teach teachers how students enter. We have to teach teachers how to teach their children to get into the restroom safely without touching doorknobs, and how do you wash your hands and grab the paper towel and not touch the doorknob on the exit as they exit. How do they social distance as they move around school buildings? So just the building protocols alone, we need professional development time for teachers and staff. We also have our teaching and learning updates that happen on top of all of this. We have to keep up with the curriculum components. We also have our new learning platform, which was shared with the Board of Education about 2 meetings ago, which is called Link It. And it's going to be an incredibly valuable tool for our return to learn planning for children. For instance, a child starting 4th grade can take the assessment that's tied to all of the standards to tell us how much from 3rd grade did they master, so that a teacher from right at the beginning of the school year can very much personalize the learning. And I think, as Kati used the word nimble, we know that we're going to have to be very flexible this year because we could be in and we could be out. So, and obviously we've changed the teaching model a little bit for summer. And Dr. Carabello, do you mind just talking about the summer structure a little bit?
Sure. What we're doing is we are doing 3 hours of summer school for teachers, and they have 2.5 hours that they will be working with students. And half of that time, 90 minutes of that time, will be synchronous. They will be face-to-face with students. They'll be working in small groups. They'll be checking in on what the students are doing. And we're very excited about that. And we're looking forward to getting the feedback from the students and from the teachers and the families at the end of summer school to see how that worked, because we heard from the community and we heard from the students and the teachers that they really needed to have more face-to-face time with our students. So we're looking forward to do that. We also have an ESY program that we are also piloting at one of our schools, that students and parents, if they want their children to have their related services in person, face-to-face, they will have that opportunity as well. The ESY students who do distance learning will also have the same format as we have for the regular summer school, that they will have 90 minutes of face-to-face with their teacher, and the other time will be spent doing activities and whatever the teacher has worked on with them.
I might just pause and ask if any of the panelists actually have any curriculum questions that or we'll continue on. Karen, is your hand raised? Physically raised? Okay.
Yes, it was, only in the fact that I couldn't find my raise hand button. One of the questions I did have was, I know that we may be shortening, hours or days if we need to, and has there been any discussion about changing graduation requirements or any kind of revision for the standard curriculum that needs to be obtained during the year for students?
Good question.
That is something that I'm certainly hoping, if it doesn't come out in this guidance, that it will come out in the summer, because the superintendent's organization has asked for many things. We need the 180-day waiver. Again, as you know, distance learning is not, we can't do distance learning in Connecticut if we didn't have the executive order. So we're looking for that. We're looking for graduation requirement flexibility at the local level, because some of the classes may not be able to be offered, or they may need to look differently. So we're waiting on all of that, but that has to come at the state level from the governor and the commissioner. But we have requested all of those waivers.
Good, thank you.
You're welcome. Any other questions on curriculum? Okay, I think we'll go ahead and move forward to the next slide. Thanks, Mike. For those of you who have not seen the CDC guidance on how transportation would work, this is a complex issue in how they have put forward how we would utilize our bus system and also social distance. And when the guidance came out from Connecticut, it basically has one student you can see on every row, so that they are socially distanced. So basically, one of our big yellow buses will hold about 12 students, perhaps 15 or 16 if there are siblings who could share a seat. So this is a very complex issue when you have the number of buses that we do, obviously. The other thing that was in their state guidance that we're under right now for summer school is every bus would have to have a monitor. Mike, go ahead and go to the next page. So right now, if we actually tried to implement that, we would need to triple the buses, just if we tried to run as normal. And just to give you a cost estimation, our busing is about $10 million a year, so we would need another $30 million if we tried to run as normal. Obviously, that's not a great option, especially given the economics of today. And the other thing is there are not enough buses available to really run buses in that manner with 12 and 15 kids on them. The state of Connecticut doesn't have enough buses, and the United States doesn't have enough yellow buses. So we are waiting and are asking every single week, what is the updated transportation guidance? We may get some guidance tomorrow or early next week. However, I think it's been a very slow negotiation, because they, again, you're negotiating with a union about what's safe also for their drivers. And the drivers have to feel comfortable. So the transportation guidance is very slow coming. So it has not moved from this as of today. And again, we'll get more updates this afternoon and tomorrow. So we will, in Greenwich Public Schools, be asking families to transport their own children, with the exception of those unique needs or those families who have no other choice but to rely on transportation. And we will be surveying our families very shortly. That'll give us some indication of how many families are really going to struggle getting their children to school and are going to need to be on a bus, even if they loosen the restrictions. Let's say they go to, well, one of the requests this last week was, can we at least have 2 to a seat? That's still a reduction, but it doesn't maintain social distancing. So at that point, we need to know how many of our students actually would have to rely on the bus. But we would need family help to run our buses next year if this doesn't change. Also, it calls for a monitor on the bus, and this would require about 80 new bus monitor positions for us to run all of our buses. That alone would be another $1 million expense, and we're not really sure we could find 80 excited people to ride the bus every day. That's not always easy to find those positions. So the current guidance also requires that we take temperatures before children get on the bus. So if a student has a temperature, who would monitor the student at the bus stop, because you wouldn't let them on the bus? And if it's a 5th grader and they've walked to the bus on their own, you wouldn't want to drive off and leave a student standing there. If the monitor stayed with them, the monitor would no longer be on the bus, so we would be out of compliance. So this is just I just share this as, obviously these are complex issues that we're working through, and we must work through if we're told that we need to comply. So I believe that the new guidance will not be as stringent, but I do think it's still going to be restrictive enough that we're going to need family help in how we run our buses, and which will have could have impacts on traffic patterns. It'll require, just like our celebrations and graduation, it took our safety and security team working with our local police department to figure out traffic patterns, because if you look at schools like Cobb, we already struggle with car traffic. You look at the high school, we already really struggle with traffic in that area in the morning and the afternoons. So it will take a team effort once this transportation is nailed down on what we can or cannot do for busing. Are there any questions on busing? I don't see any. Katie, Dr. Noble? Sorry, I have to unmute you. Sorry, you're still muted.
There we go. Can you hear me now?
Yes, yes.
This seems almost impossible and laughable, honestly. Like when I saw this prior to the talk, if this has to be adhered to in some way, shape, or form, I would think that maybe a rolling start to the school day, which I know might be complicated, but then use the same number of buses. You don't need another bus, and maybe you still need to have the monitors, but you could preserve some of the social distancing criteria. This is very, I actually think this is one of the most complicated aspects. Maybe I'm wrong, but getting kids to school, and parents that are working, this is going to be stressful for them too. But maybe a rolling start.
What I can say is I think that's one reason why the focus teams are so important, is because the people that really know transportation are working on this piece for us. Sean O'Keefe actually has been involved in transportation in his position for several years, and he did a webinar with all of the financial people looking at this from the transportation, because many of them are over operations. And it's important, I think, for the community to see what some of these requirements look like, because again, as a school district, certainly a board of education could decide this is required by the state and we're not going to comply. I don't know what state funding they would take away, perhaps, but we get so little state funding, but I'm not sure anybody wants to be in that situation because of the liability aspect if a child or a teacher or a bus driver gets sick. And I think many that are on this presentation today know we did lose a bus driver to COVID. So, our transportation team is very sensitive about, their safety. And so it is a complex issue, and I'm really waiting, which we have to know exactly where the guidance is, and then we'll move forward figuring out how we're going to implement it. But it's important for people to understand we can't just do what we've always done in this crazy COVID time. Any other transportation questions? Okay, we'll move on to food service. Oh, sorry, Karen.
Oh, I finally found the raise hand button. I was simply going to just echo what you were saying in the conversations that I've been listening to around the country about this from different states and different districts, even just in Connecticut. I know we spoke about this the other day. Basically, they said that the CDC really never kind of spoke to any educators or anybody who's involved in the education world to see if these things were feasible. There's just not enough little yellow limousines around the country to even be able to do what the CDC's recommendations are. So I'm truly hoping that the state will take a good look at this and see what's realistic. That being said, will we be considering sending out surveys to see what parents might be able to do in the ability to bring students to school on their own, or arrange possible carpools if need be?
Yes, we actually have, and I'll get to a slide in a minute, and on the communication side, there's a survey that is ready to go out early next week that'll help us understand a little bit about returning. and how many families actually would be willing to drive their student to school. Thanks, Karen. Oh, okay, next slide. Food service. So food service also has its own complexities as well. And it really comes down to social distancing and touch. And food service, again, is going to be dependent upon where we are in the phase of COVID as far as implementation. Just recently, they did come out and say that possibly with this new guidance, they will, and so we'll find out this afternoon, probably Friday or Monday, that we possibly could be in the cafeteria with social distancing with the same cohort of children. Currently this summer, we can't have any food at all for summer programming, but in looking at what we were anticipating for next year, it would have been in classroom only, so that the same children who are in school together are also eating together and eating lunch, which means brown bag lunches, because we couldn't be delivering, lasagna and all types of hot foods into the classroom, not only from just a cleaning standpoint, trying to keep everything sanitary and clean, but just because you also look at the number 3, we have schools that don't have elevators. So when you start talking about delivering food to the classrooms and buildings that are not ADA compliant, that just delivering the food is a challenge. And the other thing is who delivers the food. Who's going to be that person? Because it's not like you could ask your custodial staff to help with that when they also have higher degree of cleaning responsibilities, not only during lunch, but all day long. So would that be hiring additional staff or the current lunch monitors in a different capacity, because they have to be willing to carry a heavy load if they have to deliver to a classroom. So those number 1, 2, and 3 are going to be dependent on where we are in COVID. We also know that regardless of whether they're in a classroom or they're in a cafeteria, as of right now, that we couldn't have any long lines. Normally children stand in line, they go through the lunch line, the food would need to be distributed to students. So they would come into an environment, they would sit at the tables, have whatever social distancing feet, wherever they land. Right now it's 6 feet. My understanding is they may come down to say 3 or 4 is reasonable. They would be spaced out at the tables and we would bring food to the children. And again, it's with the same small cohort of students. So you can't have children who are not normally mixing, for instance, on the playground. However, we ended up doing recess, or as they move through the hall, like a middle school team, it needs to be those same students who are actually at lunch together. Are there any questions on food service? And again, I just will say congratulations to our food service team. They've done amazing work this summer and all spring, and are continuing to make sure that families are fed and we're taking care of everybody. Any questions from food service? Okay, we'll keep moving. And again, Sean is, I think, still on the other call too, just as a reminder, so I'm doing some of his pieces. So athletics and return to play. CIAC has their own guidance document, and it also includes the activities programming, and it's everything from disinfecting the locker rooms, how often that has to be done, how we social distance in groups, how many can be in their social distancing groups as of today, the temperature taking before they start their workout sessions, who takes the temperatures. That's a question we're trying to figure out. Is the coach going to take everybody's temperature if it's still required? All locker room benches, we have to look at all of the weight equipment. If there's a slight tear, for instance, in a weight bench, it has to be wrapped and sealed. It has to be disinfected, obviously, every day. The other thing is that CIAC has looked at 3 levels of risk. This is based on the national organizations. You have low risk, moderate risk, and high risk sports. And low risk would be something like swimming, where you're getting in, chlorine, golf, where they can social distance on the range. Moderate risk would be something like volleyball, baseball, water polo, where you're touching a ball. You can disinfect them at times throughout, you can disinfect the ball. The high risk are football, basketball, wrestling, competitive cheer, all those sports that have a lot of touch. So the sports that CIAC will allow to open up are going to depend on, again, where we are in COVID-19. And are they comfortable with a high risk sport, or are they going to keep us only running low or moderate risk? And again, that whole guidance document comes from the CIAC. Are there any questions on that? It has its own set of protocols. Let me say that.
Tony, do we know, would those same requirements apply to intramurals?
We would apply those to intramurals because they use all the same spaces.
Okay.
Yeah. Okay, no more questions. We'll go ahead and move on. When we look at facilities, disinfecting and cleaning, letting you know where we are, Dan Watson and Tom Bobkowski do a lot of this work for us. So they've been terrific helping us get ready for summer as well as next fall. So we have a cleaning product called Viking Pure Clean and Viking Pure Sand. And these are approved for COVID-19 disinfecting, safe and non-toxic, which is really important. And we have the equipment now installed at 5 places around the district. So we are able to create our own. We have plenty of disinfectant. We can do 200 gallons a day. And it's installed, we're using it. We were using it in the spring and made adjustments to increase what we had available to us, knowing that going into the fall, disinfecting is going to be enormous. And we don't want to be reliant on not being able to make some of our own solution and being able to get products, which is something we really dealt with at the beginning of COVID, was just trying to get your hands on some of the products and things that you need to make sure that things are disinfected. So we're in a very good place for that. Go ahead and go to the next slide, if you would please, Mike. Also, our paper towel dispensers. And again, when we talk about high touch areas, our facilities team and safety security went through the summer guidance, literally page by page as a team, and really tried to make some big decisions about what do we need to do now and what are some things that we're not going to do, either because just trying to get them done in the summer was extremely taxing or the cost was prohibitive. And paper towel dispensers are one thing that we knew that we could go in and do, and we've already done them for the summer school. We're going to work on these by the time we come back in September. We've disconnected and removed all the blow dryer type units, which spread the disease if somebody's washing their hands. And again, that's from the guidance documents. We're in the process of adding the touchless pull tab dispensers so that children don't have to touch the unit. They pull the towel down with their hand. The next one automatically pops out. We're also in the process of adding touchless tissue dispenser and trash receptacles outside all of our restrooms. And that is because in the guidance from the CDC and also the state guidance, they talk about trying to change all of your faucets, for instance, to be touchless. That is millions of dollars. You know, in a district our size, we have so many sinks around our district that we didn't feel like that was reasonable or prudent, either one. So what we're trying to do is make sure our students have a safe way to get in the bathroom and out of the bathroom without touching the door handles. And that's part of that protocol that I was mentioning earlier, that we will have to teach children how to do that. You know, teachers need to be shown how to do it. Here's how we want to show the children. And then we'll have to help our students make sure they know that this is here to keep you safe, and here's how you use it. So the tissue dispensers that are outside the door, there's a trash can. So once they open the door, they drop it right in the trash can. And as you can imagine, just with the number of bathrooms, the impact on our custodial staff trying to empty trash cans. That sounds very small, but we believe going into September, we will have a request for 13 additional COVID-19 disinfectors, I'll call them, helpers with this, because just the disinfecting alone and the additional work, we simply don't have the staff. So we're looking at that temporary staffing that would be needed. Go ahead and go to the next page, if you would, for facilities. For PPE equipment, masks and gloves have been ordered and received. We still have some that are on back order, but we already have 10,000 of those that are in the district and ready. Our goal is we do believe masks will be required, even in the new guidance, is what we're hearing. That we are asking families to provide their cloth mask. We believe most of our families will do that. We will have masks available for those children that forget theirs, or the family would rather them have a school issued one. Shields and plexi units are ordered for summer school, and the shield is for a teacher who wants that higher level than a mask, or if a teacher, for instance, is having a speech session and they want to have their face covered, they need to be able to see their mouth. You know, the child needs to be able to see their face. The plexi units that we've ordered for summer school, we want to analyze that they're actually the ones that we really want, because you don't know until a product shows up, but it basically sits on the desk, so that you can be closer to a student, just like you would see at the grocery store and everywhere else where they put plexiglass up. But these sit comfortably on the desk. It's not awkward. It shouldn't make a child feel uncomfortable, but it allows a little bit closer distance and still keeps everybody safe. And we're going to make sure those are the ones we really want to order for September. And we'll make that decision within that first or second week of summer school. We have our nursing protective equipment has been ordered for summer school, and some of that also will roll into the fall. Hand sanitizer was something that was in the last guidance document, and they want us to have hand sanitizer available in every classroom. We have made the decision that we think that that's a good thing to do anyway. So if the guidance changes tomorrow, we would still go ahead with this. It gives a level of comfort to the staff to know that they have that. Also, the temperature stations. Right now we have handheld thermometers for summer that we're going to test, see how difficult or how easy that is. But we're waiting on the newest guidance before considering tent entry into the buildings. And what that means is, if you've seen, whether it's been in Switzerland or China, around the world, they will have tents, long tents that kids walk through, and you're taking their temperature. So if it happens to be raining outside or something of that nature, you're taking their temperature before they enter the building, and that way they don't enter the building where you have to then go disinfect wherever they've entered. But we feel like that's one step too far until we get the guidance. Because if they're going to have the temperature taken at home, for instance, and there's going to be a family checklist, and we're not going to take temperatures when they enter the building, then that's going to be a different scenario. So that will be something over the next 48 hours, I'm hoping that we get more clarity on. Do we have any questions on the facilities disinfecting and cleaning section? Karen?
Sorry, I just wanted to make sure. I know you mentioned that there will be, more likely than not, requirement for masks. I just want to make sure that for students who or educators who have health issues that require that they can't wear them for some odd reason, how we're going to handle that in regards to somebody who has breathing problems to begin with, asthma or whatever it might be, that precludes them from wearing a mask, or a student who might have a disability. I know you mentioned the plexiglass, who needs to be able to read lips or whatever it is. I just wanted to make sure we're looking into what to do for those situations.
Yeah, the mask alone, it's another complex issue. I think everything in this whole thing is complex. We have families who have already emailed me that say they will sue the district if we make their child wear a mask. So I'm just going to be very straightforward about it. So if a child shows up and they don't have a mask, are we sending them home? If it's required, or is it the guidance document? And this is where it gets complex. If it's a protocol and it's a guidance, and you have one or two families who choose not to wear a mask and don't send their children, the way the guidance is written right now, if it's a child who's uncomfortable, like they just don't want to wear one, it scares them, makes them feel uncomfortable, you don't have to make them. Overseas, what they've done, and again, until I see Connecticut guidance or requirements, because those are two different things. Overseas, children would wear the mask entering the building. Once they got into the classroom, they could take them off. And that was pretty typical as we were watching schools reopening this last spring. And that was because they were with the same cohort of children all day in closer proximity, and they felt instructionally it was better for children and young people. So we're going to have to watch, and what the protocol will be. We're going to have to be flexible. I can't imagine that we're going to be fighting with families over wearing a mask or not wearing a mask if they tell them that they have to. And most families would probably just say it stresses my child out to wear a mask, and then that would be an acceptable response. Now, how do teachers feel if they have a class of 15 or 20 children and 10 of them are not wearing masks? Again, that will be, we're a bargaining state, and I'm sure CEA will have some, the Connecticut Education Association will also have something to say about what they believe about masks when they see the guidance. So it's going to be complex, even just wearing a mask or not wearing a mask, because people have very different viewpoints on what they want for their children and young people. Any other questions on masks? Yeah, it really comes down to supporting, it'll probably come down to supporting what the family wants, is the long way of saying that. Next slide. Safety and security, we've ordered the social distancing floor adhesives, and we've gone with one color all across the district so that if you go from building to building, it doesn't change. It's yellow, so it can't be mixed, to figure out each building is unique. So the way, for instance, if you're entering the cafeteria, having those dots on the floor where children would stand according to social distancing, that'll be individualized for every building. The traffic coordination I mentioned earlier is ready if buses are limited, and traffic patterns and staggered starts are necessary. Once our scheduling is done, that's again, Tom Bobkowski, who will work with the police department, just like he has for years. And with any big events, this will be much more complex, but we'll have to look at each building individually. Some buildings have a lot of buses, some have a lot of cars, vice versa. But traffic coordination is again, something that's gonna be complex once the schedules are finished. Any questions on just social distancing, floor adhesives, movement around the buildings? All right, we'll move on to the next one. Human resources and staffing. I know Shemaine is on here. Shemaine, do you want to share anything that's on this slide? I think you might be muted. I can't see you.
Can you see me? Can you hear me now?
Yes, I can see and hear you now.
Okay. You just want me to speak to where we are, what we're planning to do?
Yeah.
Well, the HR department has been working. I'm sorry, can you hear?
Yeah.
I'm sorry. So Ann and I are in the same room, so she's getting a little background noise. But the HR department is working with Dr. Jones to put together a survey that we are hoping to send out to our teachers to get a sense of what their level of comfort is in returning and or what concerns that they may have. We're hoping that that would be information that would be really good for this committee as we're planning forward and may have to do some things differently. And I guess once we start with that group, we will focus on our other, all of our other groups. Here on your, I'm just looking at your, because this is the first time I've seen this. Do we have adequate staff to meet social distancing guidelines? That survey is going to give us that information. How many staff are compromised and could be expected to have a doctor's note or non-return? We've had some issues with this with some of our non-certified staff members that we have spent, we've kind of gone back and forth trying to resolve and have been able to successfully get through the year. I do anticipate seeing more of this with our teachers. I have to say that we didn't have many individuals report that they had experienced COVID. Many of them kept that to themselves. We found out about that after the fact, especially with schools reopening. I sense that people are going to be a lot more vocal about that. And the third bullet is the assessment of staff will happen over the next few weeks. Yes, that relates to the survey. I'm sorry, any questions for me?
Dr. Noble, you have to unmute. Sorry, you're still muted.
This may be something that you've already talked about at length, but is there a means by which we can have the teachers teach through Zoom? So have distanced teaching. And that way, it pains me to think that these wonderful teachers may not return at all to teaching. And can we just have the students go and pipe in the teachers?
I might answer that. We've had discussions in that we believe right now the guidance is going to come out and say that we must offer face-to-face and distance learning for those families that want it. That we're not even going to have a choice to say everybody goes back to school. We're going to have both of those. The teachers who feel compromised because maybe they've had cancer or they are pregnant or they have asthma, those teachers certainly could become that distance learning team. And we have to figure out what is that number. Nationally, when the National Education Association surveyed teachers, The scary part was about 20% of the teachers felt that they may not be willing to come back in the fall because of being compromised in some way. If that number is really that high, then it's going to depend on how many of our families actually feel that way. And I know at the state level right now, they're anticipating about 20% of students and families will not want to return given the current situation. So if that's the case, and we can match the numbers, then it works. Where it gets very difficult is if we have a large number of teachers that are no longer available face-to-face, that can be a decision maker on whether we can return to school or not, because we don't have the substitutes to step in for distance learning. And I do not believe we're going to have a high substitute pool. It's difficult anyway.
But
And
why can't you have the teachers teach from home and have a big screen up at the front of the classroom and have your 12 students or 15 students in there with a teacher's aide in the classroom to prevent them from throwing spitballs, but have the teacher piped in, and then the teacher can continue the job of teaching. And particularly I would think with the high school teachers, they're already specialized to teach biology or English or whatever. I mean, I imagine the teachers are not going to be completely interchangeable. If somebody doesn't return to teach chemistry or biology, you can't put in an English or a history teacher, right?
That's why I'm saying it's going to depend on the staff, who they are that are compromised, what are those subject areas, how many students want distance learning while the teacher's sitting at home. But to actually put a teacher assistant, in a class, a teacher assistant in a classroom, and you have the teacher just on a smart board or something, doesn't mean you couldn't do that. But again, we would have to get guidance from the state if they would even allow us to have our students in a room with a non-certified teacher for a number of other reasons. Distance learning is different as far as utilizing Zoom, and distance learning and face-to-face is very different than looking at how many teachers are compromised, how many children also want to be home versus want to be in school. Because we have to have teaching staff to get children back to school. So again, it'll depend on the percentage. And CEA has done some surveying of staff in Connecticut, and we'll just have to wait and see where that ends up for us, for Greenwich.
And Dr. Jones, that conversation as it relates to the professional assistant, their contract states that they can't be solely responsible for students.
Yes.
So to have a teacher assistant left behind with the students is not something that we can suggest as a viable option without them sitting at the table and negotiating or being willing to put that responsibility on the professional assistants.
Yeah, as a matter of fact, you just reminded me, Shemaine, we had this discussion about 2 weeks ago because the guidance was going to come out that we believed from the state that they were going to encourage us using professional assistants to actually get the small groupings of 10 to 15. And it did not get past the state discussion for, I think, what Shemaine she's just referenced.
This is Mary. Do we have any idea when we'll get guidance from the state about what the allowable excuses are or medical conditions are that would allow teachers to opt out of coming in? Because I'm just afraid in some of those more unique teaching situations, trying to find replacements for live teaching may be difficult.
That what I believe will come out this afternoon or within the next couple of days is a doctor's note, and that is it. They're not going to get into certain health requirements. It will be probably a doctor's note, and that's, again, as you know, as I do, that's wide open for a variety of reasons. It could be anxiety, it could be mental health as well as physical health. So we'll have to analyze all of that. That's why I say it's going to be complex, just trying to get everybody back. But we'll continue to work through it. Any other questions on human resources and staffing? Communications. Sasha did a great job for us this spring, helping, really push out a lot of information for our families. We're going to continue through the summer months, letting our families know. We will have a communication that will go out tomorrow. We wanted to wait and see if we got any more guidance from the state today and tomorrow, because I kept saying it was coming. So if that comes, we'll be able to give our parents the most up to date. And we're also looking at the survey that we'll launch next week, which helps us with understanding their comfort of returning in general. And that should give us a little indication of that 20% of families that are not comfortable returning with things as they are today. Or is it going to be 10% or 5%? We are going to survey our teachers in regards to the compromised return to work. And then Sasha Houlihan will also be leading on the how-to videos for school communities. Again, as we've looked around the world, and what was very helpful in re-entry and the protocols and the differences are having some how-to videos, for instance, on how you do enter the restroom and how children wash their hands. So parents can watch some of those short minute, 2-minute videos before children come back. So it's, and young people, so it's familiar. It doesn't feel like on the first day of school, they don't know what's going on, because it will feel different the way children enter if social distancing is still required. And we believe that, you know, it will be, whether that's again 3 feet, 4 feet, 6 feet, we believe it's going to be different. But making some of those videos to help children and young people understand what some of those protocols will be, because it is different. Any questions on communications? Okay, next slide. This summer, we've talked a little bit about special education and unique learners. We will be evaluating our summer program. What's working? What do we need to adjust going into the fall? What is the strategy for the PPT and evaluations that were put on hold so that we can get caught up in that area? We are going to have to assess the rate of learning for all learners. And again, I mentioned Link It earlier in the year, and I think for some of our learners, that will be a great tool also for special ed. And then just the rate of language acquisition for our EL students. Some of our EL students that have been at home, for instance, if they're Spanish speaking in the home, they've probably been around more Spanish than English, obviously, since March. And so we want to assess their rate of learning also for English acquisition. So Mary, I don't know if you want to chime in at all, or and either one of you on anything that has to do with unique learners or special ed.
Just, I'm participating in a meeting on Monday where we're going to start the conversation about compensatory education versus recovery services, and what some specific indicators are for whether certain groups of kids should come back into school sooner rather than later. It certainly has been much more impactful for our kids with disabilities.
Yeah, absolutely. And I don't know if you have anything to share about the summer programming, Mary, how many students you've ended up with?
We have about, well, I don't have the exact number because it changes, and I have to say it changes as the environment changes. You know, as things started to kick up down south, we had a couple teachers back out that we were expecting to come in. We are expecting about 40 students to come face to face. We sent out the guidelines to the families about what's the expectation is in terms of temperature checks and masks and cleaning. And right now, those families are willing to work with us and give it a go. And as Tony said, I think this is going to give us some idea about what we need to be aware of if we're going to come back in the fall in terms of getting kids in, how quickly they get in, you know, what's the backup and moving them through the halls. And we are also continuing with distance learning related services and special education for those students who are ESY eligible.
Thanks, Mary. Anne, did you have anything on EL that you want to add, or for your?
For EL, I think that Adrienne and her team have done a great job checking in with all of the students and the families that qualify for language learning. And I think that she's got a pretty good handle on it.
Okay, thank you. Any questions on special education or unique learners? No? Yep, Karen? Oh, let me.
Sorry. Is there a way for us, you know, I know you were talking about a strategy, maybe this is more for Mary, but for all the PPTs and evaluations that were put on hold, you know, I know that there's a lot of students that are looking to get their hours in, just graduated college, you know, grad school with their degrees. Are we looking to possibly even offer those opportunities for internships for some to help get through some of the work in advance? If we need extra staff and we can't, you know, fully pay, if we're looking to, you know, to do that?
Well, some of it is the writing of the IEPs. That's really got to be done by the staff who work with
Right.
them. We do have some interns working this summer in the summer program.
Okay.
For those kids, we just have to make sure that we meet the internship requirements of the school. But we do have, I think, three or four interns working this summer. The PPTs, a lot of it is a scheduling issue, trying to get everybody on the same meeting at the same time. We are going to be starting face-to-face evaluations on July 6th.
Two
At
for
Costa.
speech, and then
So we are looking to begin with those students.
Garfield sent us 3.
Mary, you're not muted. So we were looking at some of those kids who we started the evaluations and didn't get to finish them. Those will be our first priority. Then those students for whom we took consent, but we didn't start the evaluation, would be the second priority. And then we're looking at students whose parents gave private evaluations. So we have a kind of priority list of who we're going to evaluate. We have staff who have indicated that they are willing at this time to do face-to-face evaluations using the, I believe they're called sneeze guards. So we're going to be using the sneeze guards, and we will roll through as many kids as we can this summer. So we're trying to catch up. And we do have some parents who've indicated that they wanted to wait until the kids got back into school before we redid the IEPs. That's going to matter on when we get back into school, because we don't have a lot of really good current information given that they've been out of direct instruction for so many months. But we do have some interns that we're already using in summer school right now.
Yeah, because there are, I know especially with students with needs, learning differences and other types of needs, there may have been a, what they'll want to call the COVID slide, which will be even further. So, I know that we're looking at a lot going ahead there. So
again, I think a lot of that is going to be the discussion on Monday at the state ed meeting. The two terms that are used as terms of art are compensatory education and recovery services. And what is the difference? How do you determine who gets what? I should have more information on that after Monday.
thank you.
All right, any other questions? Okay, we'll move to the next slide. This is probably, again, I think I say this on every slide, that it's very complex. I think all of these every department is having to really work incredibly hard right now. School scheduling complexities. As we said at the very beginning, one of the goals is trying to get K-5 back in school. I think the guidance when it comes out today or tomorrow will probably help support that more so than the summer guidance, because the summer guidance was very, very stringent. And what we do know is that we've evaluated each elementary classroom space for room usage and square footage. So we know where there are spaces within a building that, given the grouping, the cohort numbers, how can we make more groups of children? And an example would be for summer school, they set the number at 10 students in a room. And it didn't matter how big the room was, it was just groupings of 10. The CDC guidance was around 15. We really are looking at, what is a reasonable class size number where parents will feel comfortable. And right now we have 197 sections across K-5 that is projected. Of those 197, we have 22 different grade levels where they're sitting between 20 and 22. We are trying to get everybody under 20 if we could, and just in how we space out. We have 4 grade levels that are greater than 25, which is actually, that's a good thing in that there aren't so many, but it means if they're going to have greater than 25, they're almost ready for another teacher, but not quite. It means in those 4 schools where they have that challenge, they're going to have to put classes in the larger spaces, so you have more square footage per children. And again, this will depend on what is the social distancing. Is it going to be looser like it is in Virginia, where they are basically telling schools, try to do the very best that you can in spreading children out and keep your groupings as small as you can for a school district? Or is it going to be a very tight restriction, which is where summer guidance started? And the key question is that social distancing. And we're looking right now, again, at the plexi dividers. Mary just called them sneeze guards. The plexi dividers that we have for summer, are those going to be high enough quality? Do we like when we actually see them and use them? Could we actually be putting those on our tables so that as our elementary classrooms are doing station rotations, because you know, as a reminder, you know, Greenwich is a progressive school district, so we don't look like school districts did back in the 90s, and some of them still look with lots of desks in our elementary. We got rid of all of them. So we're more of a, we believe in collaboration with children, and we have tables, and we can't throw out all of our furniture in 11 elementaries, even if we wanted to do it and try to get different furniture in by September. And we hope that COVID, you know, that this will go away eventually when there's an immunization, and that we'll be able to teach the way that we believe is right for children. So we don't want to throw all of our tables out, but looking at getting some of these on the tables to actually, again, just to make it that much safer of an environment. So we're looking at that. Elementary, again, it's trying to get children back in 4 to 5 days a week, so that, you know, we can help families. When we look at our middle school scheduling, which is the next page, we are exploring, could 6th grade be located off-site? This is a big topic of discussion. And again, until we really get the guidance, this question is hard to answer about what we need to do because of the grouping numbers and how much space is available in our middle schools. Again, we've looked at our buildings. Middle school, especially when you have a building like Eastern, is maxed out. So if we are trying to social distance and have even teams of children move through the halls, we really need fewer children on site. So you're either looking at an alternate location for one grade level to try to be able to spread out within that building, or you're looking at alternating within the middle school. And again, we're trying not to have alternating schedules if there are other solutions that we can consider. And ultimately, this will be a Board of Education decision. We're doing the homework so that we can inform the board this is an option. And, you know, if there is a way to offsite, for instance, 6th grade, then that gives us, again, an option the board can consider that perhaps could get our kids in school 5 days a week versus alternating where kids are in school every other day. But again, this is going to come down to COVID and what level of COVID-19 we're in and how much social distancing has to happen. We're also looking at how we can capture those elective spaces. And, you know, for teachers, there are some electives that are going to have to be taught in a different way. And they may not be taught within the actual environment. So it gives you extra classroom space when you look around a building. If it's a high touch elective, for instance, where like clay work or something where kids are really having to share and touch a lot, that's done in a different manner. And we actually experienced that this spring. You know, we actually are, like our clay was sent home to students so they could still do it even in distance learning. When you're on site, it's going to be a little bit different to try to avoid some of that high touch. But again, the goal for middle school is trying to get kids in. We have a space challenge right now that we're trying to solve. And we'll have more updates for you even as we come into our next meeting. Go ahead and go. Any questions on elementary or middle before I move on to the high school? Shemaine, did you raise your hand or were you just waving? Just checking.
I was moving my hands as I was talking. I was actually saying to Ann, why wouldn't we consider having 8th grade possibly be the group? Because 6th grade, as much as they don't like to believe it, they're still babies. I was just trying to understand what the thought process was.
Yeah, no, that's a good question. And we've talked about 8th grade as well. You know, originally, even talking with the high school, we looked at even if 8th grade could fit in one wing of the high school and still have, you know, a portion of the high school on site. Numbers wise, that doesn't stack up. Whether it's 6th grade, 8th grade, 7th grade, that I think would be definitely, you would want community input, you'd want parent input to help the Board of Education inform. The other thing is the size of the groupings. When you look at the enrollment numbers, it has to do with what size of the groupings are you trying to move out of the buildings, because each cohort is different. So, and we also need to figure out if we move off site, where would that be? And we don't have really a good answer yet for one of the places that we're looking at or considering, what is the real number of students that could be in that place? And until we know that, it's hard to say.
That makes sense. And that 8th grade class is a large group.
Yeah.
That's a very large group this year.
Yeah.
Just one question. If we could also just try and consider if there's any way, if we have to do in school one day and out school another day, if we could find a way to pair middle school and elementary school so that families have both levels of kids in or out on the same day. So if we go to like an A day, B day, so that if I was a parent with kids in 5th grade and 6th grade, that I would know that my both kids are in on Monday and out on Tuesday, so that we can help those families who need to get back to work.
Yeah, we're going to have to look at, I'm already getting emails about that. As a matter of fact, I had 2 this morning where parents are already worried that they could, just by what they're hearing in the news, that they could end up having one child on school, you know, Monday, distance learning Tuesday, and their other child the reverse. So that's definitely going to have to be part of the thought process. It is part of the thought process. Anybody, any other questions on scheduling as we're working through? Looking at the high school, obviously the high school again it's a challenge because we have 3,000 students in a building that's at capacity. So if you ask us if we can social distance and have school as normal in September, we will tell you no, because we can't. You can't social distance that high school. So, you know, if that is the requirement and we feel like safety is of the essence, they're going to have a schedule which looks different. They have their own opening committee because again, it's the scheduling component. You need those educators around the table who are looking at all of the different structures and the way it could work, because high school schedules alone, once children elect the courses they want to take, the students elect their courses, all of that is automated into a system for them to get a schedule. And again, you're talking 3,000 students, it's a lot. If you change the schedule, you have to actually reload how that looks, even with an Aspen. We do know the drop schedule was not effective for distance learning. Even the teachers provided feedback on that. They forgot which day it was. You know, it was hard to keep up with the A, B, C, D, E, F, G, H days. And it is a complex schedule. So they're looking at how they can schedule a little bit simpler, and they need to be very nimble again to move seamlessly as they're needed to be. If you in a large building, it's highly likely that we're going to have some aspect of COVID that could actually shut the building down by health department requirements for 4 days, 5 days, deep cleaning, ever how long they tell us, and then come back. The high school is also exploring different schedules like an A-B schedule where the students would be in Monday, Wednesday, another group Tuesday, Thursday, which means you'd have 1,500 students in that building on any given day. And then Friday would be alternating so that over a 2-week block, students are on site five times. And then the days that they're not in, it's much like a college schedule, and that the teacher has provided the work that they're doing in distance on their day that they're at home. So that's all being looked at right now of what is the possibility. They've been working, I want to say probably a month actually, because they know it's such a big complex issue, and we'll get another update early next week from them as well. Any questions on high school scheduling? I will say one thing we were trying to avoid is AM PM schedules. We certainly could go back and look at that, but the cost for AM PM for a district our size is enormous, because it means you're doubling again the amount of busing and routes and the tiers that we would need on any given day. So we could do AM PM, but we would just need to know up front it's another $10 million cost just to change that busing structure. So that's one reason we're looking at AB. I've also had people who have sent emails that are wanting us to look at the 10-4 cycle. And the 10-4 cycle was originally recommended. I think it actually originated from the CDC. And on the 10-4 cycle, students are in for 10 days and then they're off for 4 days. And then you have different groups that are doing that. The difficulty again is you've got kids at home while parents are trying to go back to work. And it's not as set of a schedule for parents because a 10-4 is difficult to do in a school schedule that's 5 days a week. But all of that is being explored. Right now, the committee is really looking more like AB as of today. And again, we're going to see what guidance comes out, because social distancing makes all the difference in the world. But I can't imagine that as we go into the year, at some point in the fall or in winter, that we're going to have to be on some sort of hybrid. Karen?
So I actually have 2 questions. I know you said the high school has their own committee looking into this. Will they be, how often will they be sharing their information with the full committee here.
Yeah, so they, right now, we're giving them this week, and then next week we'll start bringing in some of those groupings. So today was really the broad overview of everything. And then this committee I know is going to want to hear probably the most about scheduling, starting out more so than disinfecting and, you know, and those sorts of things. We just wanted to give you a broad overview. And as a matter of fact, on next week's meeting, I would like the bulk of that meeting to be on scheduling. So we may invite the high school if they feel like they're ready. You know, they've done a lot of work, but it's making sure they're comfortable to come and say, here's where we are and here's what we're thinking. They had to load their whole schedule first and see where the requests were, what that looks like. They are, I think, at that point now. They've had the discussions with their committee, so they may be there. And then by middle school, we will definitely have, I think we'll be in a better place next week about offsite. Is that something we can even consider? And if we can't, what does that mean for middle school and social distancing?
Yeah, I know we had spoken about this during the school year, especially at the high school. They have very little time to sort of make up any missed education. You have kids who are taking AP courses that there's, you know, and high level courses that it's very hard to teach themselves at home. And so I know that this is of a big concern, especially for parents of juniors and seniors, and obviously, you know, incoming freshmen. I'm not leaving sophomores out. They're exceptionally important too. I just know that this is probably the biggest area of concern. I know parents at the elementary are worried about having somebody to oversee their children if they need to be at work, but it's the same at high school, because if you're talking about social, emotional pieces, that's the age group that will have more access to things that might be concerning if left home alone as well. So it's a big concern.
Yeah, it's trying to get our students in school as much as possible. And high school, again, it'll come down to that social distancing, and that may be a board decision. You know, as a community, if it's just guidance and the community wants to go ahead and send their children to have 3,000 students there, but from a school district perspective, we will have to be able to say we cannot social distance 3,000 students at GHS, and we'll be very transparent about that. And you know, if that's a decision that the Board of Ed decides that we'd rather have them all, give them the option to all be on site if it's a guideline versus a requirement. So it'll be a tough one, but we're doing the best that we can to look at what schedule will give us flexible to be in school, high quality instruction, and also on a dime be able to have them all home distance learning.
Okay. Thank you. I know that, you know, we'd love to hear from the high school team as well.
Absolutely. Any other questions on scheduling for GHS? Okay, next slide, please. Thanks, Mike. So these are our task force meetings that are coming up, and I know the task force, I believe you got your invites. If not, we'll make sure those go out ASAP. And we will focus that next meeting on scheduling. It sounds like, Karen, that's what you're requesting, I think, is and the whole meeting will probably be on scheduling, because today, again, a lot of this information, we will also update you when the guidance comes out. Again, either today, tomorrow, whenever the new guidance document comes out, we'll make sure the task force gets that information. There may be some components that we will want on that agenda other than scheduling if it has something that we weren't anticipating. But other than that, we'll focus on scheduling for the 30th. Next slide, please, Mike. These are focus group inputs that Anne is working on, Dr. Caraballo. An elementary teacher focus group, secondary, our specialists. We are really trying to hear from some of our teachers about that were highly recommended that their distance learning was top notch. And many of our PTAC members have sent us some teacher names. And so we really want to consult with them about, you know, what made the parents say that, wow, this teacher did an amazing job? What was the skill set? What platforms are they using? So she's working on that. I have a PTAC input session. I don't even know if PTAC has put this date out yet, but to provide parental input on all of the things that we're working on. Again, that's July 15th. And by that time, you know, we'll have information from surveys. We'll have information from scheduling from this committee. And again, trying to just reach out so that all of at the building level, our parents and our parent community are staying well informed and providing input to make sure we're hearing from our community.
Tony, would it be possible to schedule a separate input session for parents of kids with disabilities.
Sure. Yep.
Some of their issues are a little unique compared to other people.
Yeah, no, I think that's a great idea. Absolutely.
Thanks, Mary. I was going to ask that too.
Yeah. And if there are any other, anybody else have suggestions for a group that you think would be helpful? We want to hear from as much of our community as we can. So,
Is there a possibility of doing a session just in Spanish for the Spanish-speaking parents?
sure. Yeah. Okay. Yep.
I was going to say, I assume we can add more focus groups as we move forward if we see from the surveys that we need more community input or specific parent feedback on certain topics.
Okay. Absolutely. I'm writing all this down. Let's see here. And then just the last slide is we have 2 board meetings that are already planned specifically on this topic, July 13th and July 27th, where this task force will be sharing with the Board of Education the work that we're doing, some of the decisions that are being made, obviously sharing the protocols as final decisions are, I say final, nothing's ever final, I think, in COVID-19 because of the flexibility, but what are the protocols we're going to start school with and be able to share that at those 2 meetings. And then the last but not least is just that all of this information is on the website at the greenwichpublicschools.org site. And you can see there's a return to school planning team. The minutes will be there. This task force will see the draft minutes probably today or tomorrow. Once everybody agrees that the minutes are correct, they'll get posted. And this was recorded, so the meeting also can be shared for those people who weren't able to join today. Any questions before we close out? I thought this meeting might go a full 2 hours, so we're actually about 20 minutes faster than I thought. Any parting thoughts or questions, Karen?
I just wanted to give a huge thank you, especially from the Board of Education, to all of the team members, all the administration, all the other countless individuals who've been involved in all the different committees doing all of this background work. I know how arduous this task has been. And we really, truly thank you guys for focusing on the students' health and safety, their social and emotional well-being, their education, as well as our teachers and our all the other intricacies that are going to be involved in this. So I just wanted to say a huge thank you to everybody involved in this so far.
Thanks, Karen. All right, have a wonderful, wonderful day, and we will sit and wait all day for the guidance that's going to come out this afternoon or tomorrow or Monday. So we'll see what the state has to say. Thank you again to all of the staff as well who are working on all different components. I echo what you just said, Karen. It's a lot of work, and it's a very different summer. It is just a very different summer between the budget and between COVID-19. It's been an interesting spring as well. All right. Have a great day, everybody. Bye.